This segment of Delmarva Life is brought to you by Thomas Podiatry and Associates, giving you a foot to stand on.
Well, we have jumped right into the fall sports season, and as the weather starts to gradually cool down, more and more people are inclined to get moving. Yeah, that's a good thing, but with the increase of more physical activity, that usually means an increase in injuries, particularly to your feet. Well, Dr. John Thomas is a podiatrist with Thomas Podiatry and Associates. Thank you for coming in this afternoon and talking to us.
Welcome.
So we spoke with Dr. Monis earlier in the summer about, wearing flip-flops and what kind of shoes we want to wear to prevent injury. Well, our summer shoes are getting put away. We're wearing different shoes, but that doesn't mean they don't come with their problems. What kind of injuries are you seeing?
As we come into the fall season, more people are getting active with the temperature dropping. Also, people are changing their shoe gear. Kids are going back to school, getting involved in sports, having to wear tennis shoes and cleats and stuff like that. So we see a variety of different things. Especially with the sports season, things like athlete's foot.
Let's start with that. Athlete's foot. That's something you see a lot of, don't you?
We see quite a bit of it.
What is it?
It's usually it's caused by a fungus, and it infects the skin of the feet. It can be caused. The fungus lives anywhere, dark, moist environments. So, like inside the tennis shoe or inside showers. Basically, it can come from anything, but it usually causes red, itching skin, sometimes dry, flaky skin on the bottoms of the feet and in between the toes, and it can be really discomforting for a lot of people.
Well, how do you treat it?
There's a lot of over-the-counter ways. They sell creams and antifungal sprays in the store. Usually, once you have athlete's foot, the creams work a little bit better. The sprays are better more for prevention and treating the shoes. But sometimes that doesn't always work, and sometimes you need a prescription medication, either a cream or, in severe cases, a pill.
All right, let's talk a little bit about something else you probably see when the kids are doing sports, and that is sprained and twisted ankles.
We definitely see a lot more sprained ankles, and they're usually from a twisting injury during sports, but they can also be from something as simple as stepping off a curb wrong or stepping into a hole. And they vary in degrees. There's anywhere from mild to severe, and the most severe ones can cause bruising and swelling and might need to be worked up to rule out an ankle fracture.
Yeah. All right, so any advice on how to prevent those?
If you've already had one, you're more prone to having a second ankle sprain. So if you have a history of them, usually a lace-up ankle brace or a high-top shoe can help you prevent it. If you're going to be doing any jumping sports, such as basketball, a shoe that goes above the ankle a lot of times will help.
So you get all that support.
But there's no way to truly protect yourself just from walking around and possibly stepping off a curb or into a hole.
Just watch where you're going.
Yeah.
Okay. All right. Something that you probably see a lot of is bunions. And I'm really starting to understand them because I think I'm getting them myself.
A bunion is usually a bump on the side of the big toe. We see them more often in women than men. In men, they're almost always hereditary. In women, it seems to be a mix. Some from poor shoe gear, like pointy-toed, high-heel shoes, and you also have some that are hereditary. They're not something that's going to really harm you physically, but they can be very discomforting. And unfortunately, the only way to get rid of the bump is usually surgery, but you can make shoe gear modifications that help with comfort. And the main things are going to be a softer shoe that doesn't put pressure on the bump. If you do need a leather shoe or something dressier, you can have the shoe stretched in that area.
Oh, really?
Yeah.
Okay.
But besides that, padding, that type of thing, the only way to truly get rid of the bump would be a surgical correction.
Okay. Something else, like the tight shoes I know can aggravate are ingrown toenails.
Yes, they can. And this time of year, when people are starting to wear shoes after they've been in flip-flops all summer, they might have been dealing with it, but it can really aggravate it where we actually see them come in. And sometimes it can be hereditary, and sometimes it can be improper toenail cutting. The nail should be cut straight across, not back into the corners. Sometimes when they're cut into the corners, a little piece can get left.
Yeah.
But they can be problematic and they can get infected.
They get painful.
Sometimes they need a procedure, and the good thing is that if you have a history of them where they keep coming back, we can do a procedure that's permanent.
All right, and finally, plantar warts.
Plantar warts are caused by a virus. Again, the virus can live anywhere. Usually there's some sort of break in the skin, whether you stepped on a sand spur or something, but not always. And then the virus can get in and infect the skin. They can be difficult to treat. There are over-the-counter remedies that help some people, but not always. So sometimes you need a stronger medication applied in the doctor's office, or actually need the wart cut out or burn out.
And that's where you guys come in.
And that's where we come in.
Not always the most favorable topic of conversation, but important nonetheless. Dr. Thomas, thank you so much for coming in this afternoon. To read more from Thomas Podiatry and Associates, go to delmarvalife.com.